Hello everyone, Dr. Rajiv this side. I'm an MBBS gold medalist and resident cardiovascular surgeon in Moscow. Now, I want to talk to you about carotid endarterectomy, why we do it, when we do it, and what you need to do about. So, first thing, carotid endarterectomy is indicated when you have stenosis in the internal carotid artery more than 70%. So, that is a clear indication. For asymptomatic patients, but if you have symptoms, then maybe 60-65%. Usually the symptoms that patients complain about is depleting memory, or some memory loss, or some sound in the ears, or some nausea or something. So if you have these symptoms, of course you should go and consult to your doctor, and you should do an ultrasound examination of the carotid arteries, and then also a CT contrast angiography of arteries of the neck and also of the head, so that cardiovascular surgeons can identify the atherosclerotic plaque in your artery, and we can go and operate. What we do is, between the mastoid process and the head of the sternum, here is the carotid triangle, and inside the carotid sheath lies the carotid artery, vagus nerve, and the internal jugular vein. So we give a little cut over here. We dissect the skin subacute platysma, and then you will find the facial vein, which is the branch of the internal jugular vein. You ligate it, and then you will reach the internal carotid artery. And there are two ways to do the carotid endarterectomy: classical, where you give a transverse incision, and also eversive. Eversive is what I usually prefer more. You can do it under local anesthesia, or also you can intubate the patient. Now, once you remove the plaque, you need to make sure that you are not disturbing the nerves which are nearby. And the most important complication that you should note, that is perioperative and post-operative, is stroke. You need to take care of it, that you are not clamping the artery for more than 10 or 15 minutes. And you can also use a transcranial Doppler ultrasound, which monitors the SpO2 of through the dural venous sinus, and if it's falling or it's below 40%, you should immediately intubate the patient, and you should also monitor the vitals of the patient. After this, the patient would be for 1 day in the ICU for monitoring, and then the next day we usually discharge the patients. Usual symptoms, they go away, and the surgery lasts for 1.5 hours. The complications: stroke, biggest complication. It can be perioperative or post-operative. Also, you can damage the nerves nearby, the 9th, 10th, 11th, and 12th cranial nerves, and you can have the symptoms. But this is a life-saving surgery, and you must, if you note the symptoms, you must go and get it treated. Thank you so much for watching.